Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, in this edition we are participating in the International Database Competition 2025 held by the American Statistical Association. Okay, next we will discuss an analysis and findings that we obtained and we have included in the PowerPoint that we have created in the introduction, which will be explained by our member, by Aptal.
So, what are the health aspects that we should consider? There's so many health aspects that we can analyze, but we think these two are the most fundamental life aspects that can involve the life expectancy. The first one is hospital infrastructure. It includes all the buildings, equipment, and systems that help the hospital run and provide healthcare services. There's a positive trend that between the correlation of the number of hospital beds and the higher life expectancy. And the second one is universal health coverage, a healthcare system in which only individuals and communities have access to essential quality health services without experiencing financial difficulty or hardship. And the third one is the doctors per 1,000 people. The number of licensed medical doctors, including general practitioners and specialists, actively providing care for 1,000 people in a country. For instance, there is Niger, that means 4,000 doctors to meet international standards, but has only around 44,000.
Okay friends, now we will go into the discussion which we will focus on the health aspects that influence the mortality rate in 5 countries for 6 years, from 2018 until 2023, which will be discussed by Fitri Indra Ramadan and Haryansyah.
Modern infrastructure, medical equipment, and digital health system improve diagnosis and treatment quality. Monaco benefits from advanced hospital infrastructure and health information systems. Indonesia and India are expanding telemedicine, so digital health gaps remain. Timor-Leste and Niger depend heavily on international aid for medical infrastructure upgrades.
The density of medical professionals directly affects treatment quality, prevention programs, and patient outcomes. Monaco has one of the world's highest ratio, greater than 6 physicians per 1,000 people. Indonesia and India average around 0.5 until 0.8 physicians per 1,000, creating high workloads and reduced service quality. Timor-Leste and Nigeria have critical shortages, especially in rural regions.
India reached about 70% under Ayushman Bharat. Timor-Leste and Niger face difficulties in remote areas with limited hospital beds and uneven distribution of medical staff. The contrast in life expectancy between countries from 2018 until 2023 primarily stem from differences in the quality and capacity of their healthcare system. Nations with strong health financing, accessible primary care, sufficient medical workforce, and resilient public health system achieve higher and more stable life expectancy even during global crisis. Meanwhile, low-resource countries experience slower gains due to limited infrastructure, workforce shortage, and weak preventive health capacity. From the graphics, all 5 countries saw a sharp dip in 2020 and 2021, reflecting pandemic effects. Monaco recovered the fastest 2022 and 2023, demonstrating high system resilience. Indonesia and India recovered steadily due to improved vaccination and healthcare spending. Timor-Leste and Niger high slower recovered due to limited access to workforce contracts.
Okay, it's time for the conclusion. Life expectancy has the strongest connection to the health-related factors such as access to healthcare, medical facilities, the availability of health workers, and the government response to the public health condition. Of course, the most influential factor are universal health coverage and the number of healthcare workers or doctors per 1,000 population. These two factors are very important for ensuring public health and supporting life expectancy. For the examples, this can be seen in Monaco and Niger condition. During COVID-19, the graph showed that in the same years many countries have experienced and declared life expectancy. which indicate a decrease in public health at the time. Monaco will have full health coverage and adequate healthcare personnel and improved public health, which to contribute to the recovery of the country's life expectancy. In the opposite, the limited access of healthcare and the lack of doctors in Niger make it difficult to improve public health.
Okay, that's all from us. Thank you for the attention.
Assalamualaikum.